Sagging skin is primarily caused by natural aging process.
We improve the face with toxins and everything wrinkle-free, but the neck, from the neck we can tell the age.
The treatment depends on whether they can accept injectable needle or not needle.
Hi everyone, I'm Dr. Peter Cheng, consultant dermatologist from Peter Cheng Clinic.
Hi, I'm Dr. Loo. Hi, I'm Dr. Chai.
So today we're going to talk about saggy skin. Saggy skin is actually one of the signs of aging. And we know other signs of aging like wrinkles, you have a dehydrated skin with less elasticity, you have volume loss, all these are signs of aging. And why do we age actually? We divide aging into two. One is intrinsic aging and one is extrinsic aging. Intrinsic aging means it's genetic from inside. You'll come across patients, your colleagues who is in their 50s, 60s, but they have the baby face. We can only thank their mom, their parents for that, by having the baby face. But on the other hand, you have your colleagues who just in their 40s, but then they look very old already, right? So genetic plays a role. Then we have the extrinsic factors there. Extrinsic factors like smoking, alcohol, UV, just lack of sleep, the lifestyle, the diet, all this, pollution, all this. So different factors. That day one of the patients, the wife just using me to tell the husband, to stop smoking. I say, Dr. Peter, tell him, it's going to cause aging, ask him to stop it. The husband was just in front of me. I said, yeah, I tried my best. But I always tell them, smoking, if you look at any causes of disease, whatever you name it, like cancer, like hypertension, smoking is one of them. So of course, if you can stop smoking, that would be the best. Yeah. So what actually causes sagging skin? Anyone?
Sagging skin is primarily caused by natural aging process, which leads to the reduced production of elastin and collagen. These two fibers are essential in maintaining skin firmness and elasticity. So as this declines, our skin loses the ability to bounce back and resulting in sagging.
Yeah, so that's why when I give talks, right, I always show my son's photo there, At that time, he was 4 or 5 years old. Even though he's 4 or 5 years old, you still see this fold. This is what we call nasolabial fold. It is not wrong to have that fold. Because some patients, they come to us, they say, I don't want this fold. But I say, that is not part of aging if it's not exaggerated. Of course, some patients have very exaggerated skin because the fat starts to droop. The fat on top at the cheek. There's this retaining ligaments also, we call it. Retaining ligaments, they are like hammock. When the hammock is very tight, it can hold the fat on top. But as you start to age, the retaining ligament becomes loose, becomes lax, and the fat over there becomes heavy and droops down. So that's why you get all these folds, and patient felt that the whole face starts to sag. And also we have not only skin sagginess, but as we age also, the muscle also shrink. And also the bone also resorb. There's bone resorption there. So all of these leads to further sagginess of the skin. And we know sagginess of the skin is not just on the face, on the forehead, where patients start to have droopy eyelid, where they get this fold, they get jaw fat, even the neck. So we always say, a lot of things, sometimes patients, we improve the face with toxins and everything wrinkle-free, but the neck, from the neck we can tell the age, the hand as well, correct. So these are the places where the skin will start to sag as well.
And also, if there's significant weight loss, the skin may not be able to bounce back as quickly. So this can also result in sagging in specific areas.
I mean, when we do things like cryolipolysis to reduce fat, if the fat is a lot, theoretically there might be some sagginess there. But because of that fat, when you do cryolipolysis, there's also some tightening of the skin effect there. So the sagginess of the skin is not that much as compared to if you just lose weight from exercising, from diet. Sometimes you really have that sagginess of the skin. So how do we improve this saggy skin? What are the methods?
So treatment options can range from mild invasive treatments like our therapy, which utilize ultrasound waves delivered deep to above the muscle layer, laser resurfacing, which uses laser beam to remove the top layer, triggering new cell production, dermal fillers, where we add in volume to the saggy areas, inserted threads to deep and support the skin, radiofrequency, which utilize the heat wave, Morpheus, which is a microneedling plus radiofrequency, to more invasive procedures like surgical procedures, for example, facelift and neck lift, which remove the excess skin and tighten the underlying facial muscles.
Yeah, for my patient, usually the treatment depends on whether they can accept injectable needle or not needle. So it's very fast. If they cannot accept needle, it's all the filler, botox, everything is out. So they will go for non-needle, laser, all this. Also depends on whether they can accept the downtime or want something without downtime. So I always tell them that if they want something that is very fast, they usually get more downtime. But if they want something very slow, very gentle, people won't know, they can do something like laser genesis. They can do art therapy, but art therapy you don't do it every month, but laser genesis you can do it every month. And also you can also do Morpheus 8 radio frequency, but that also comes with a little bit downtime, depending on the intensity that you use.
You know, when we first started many years ago, people used to inject fillers to the cheek to cause this apple cheek, thinking that you can lift the skin high up. But the disadvantage of doing all this is the look of the patient is very fake, right? It's just very high cheekbones, doesn't look natural at all. So nowadays also we tend to stay away from all these kind of procedures that, just trying to pump things in to lift the skin, Whereas all these devices, tend to have a patient will come back and tell me that, my friends just told me that I look younger. It's not like, what have you done on your face? How come you look so fresh? That kind of comment. I think that's what the trend is going to be, going to stay as well. Now, microneedling RF, when microneedling RF goes into the skin, we can also adjust according to the depths where you want to target. For example, some patients, they just have saggy skin, but there's no laxity of the fat there. And because inside the fat also, there are actually this kind of ligaments there, to hold the fat together. But for some patients, there's sagginess of the fat as well, besides sagginess of the skin. Then we can go deeper into the fat layer and to contract the fat, to tighten the fat. So when you tighten the fat, it's actually pulling the skin, retract down the skin. When you retract down the skin, it's also tightened. So we are not only tightening the surface of the skin, but tighten from deeper inside also. So you get an overall lifting effect of the face. And combination treatment works better, of course. If we can combine everything, like we combine microneedling RF, we combine with the ultrasound, we combine even botulinum toxin. All these things will definitely have a better results than the monotherapy. Is there anything that we can advise patients to have a younger looking skin? What would you advise?
There are many OTC, over-the-counter creams with common ingredients like peptides, which is a short chain of amino acids that can help to stimulate collagen production, like retinoid to promote cell turnover, and those antioxidants which can protect your skin from these free radicals or pollutants. So this cream, they claim they can help in sagging skin, but actually they can really provide subtle improvements in hydrating the skin and promoting cell turnover, so which may reduce the fine lines and wrinkles, but they cannot significantly lift the skin because they can't penetrate deep enough to do so.
I think, of course, we always talk about UV protection, right? Because we know UV causes photoaging. And so the mainstay is always to tell patients to avoid UV as much as you can. Try to stay away from the sun, put on your cap, your shield, sunscreen. Although it has the least protection, better than nothing, protect against UVB, UVA, all these things. And just now, you mentioned about a bit of retinoid acid, what we call topical retinoids. So topical retinoids, there are many studies to show that it has anti-aging properties in it. So we will strongly recommend to patient for anti-aging purpose. But it can only be used at night. And there are many types of topical retinoids. Some cause irritation. So that's why you see patients come to us, wow, the whole face is red after using some, for example, tretinoid, topical tretinoid. So although it has anti-aging property in it, but it's not suitable for everyone. It may not be suitable for everyone, especially dry skin. So if I see that the patient's skin is dry, I always tell them to hydrate your skin back to normal first before you start all these anti-aging creams.
Don't forget about exercise, eat well, sleep well.
Very important. Stress, right? Like we say, yeah, definitely it causes aging. So thank you, Dr. Loo, and thank you, Dr. Jai, once again for all the wonderful info. And for those of you out there who is stressing yourself out with saggy skin, don't stress, because stress will cause your saggy skin to be even worse. All right? Talk to your doctors about the different types of procedures that can be done to improve your saggy skin. Thank you.